Very good evening, friends. Meeting again in the session of Materia Medica. And yesterday we have started discussing about the Baryata Carbonica. Few aspects of Baryata Carb we have discussed with two cases of Baryata Carb yesterday. It is a remedy, the constitution of the remedy which we have discussed. It is a remedy which either very useful in children as well as very useful in old age. This is very important regarding the Baryata Carb. The dwarfism is very important. The poor memory or weakness of memory is another thing. The scrofulous diathesis, specifically in the children, the scrofulous diathesis, which is very, very characteristic. The senile dementia in old persons, it is one of the important leading remedy in senile dementia. Ellen has mentioned that it has psoric and tubercular trend, but I have told you that it has more of a psychotic element more than the psoric. So psychosyphilitic remedy, you can say it is a more psychosyphilitic remedy. So the forgetfulness, the dwarfishness, the hysterical woman, deficiency of heat, the chilly most, all those things regarding it we have discussed. Today, I will going to share first the case, and which was a wonderful case I have treated in ICU. I was called by one of my friend in his ICU. The patient was admitted over there for nearly about 7 days for the paralysis, one-sided hemiplegia. It was due to the congestion to the brain. There is a little bit hemorrhage and paralysis developed. The fellow was nearly about 75, 76 years old, and this has happened all of a sudden. And when I observed, he was in a little bit confused state. When I used to ask the answers, he was not able to answer correctly. Many times he used to forget. I started, what's your name? He was little bit confused regarding the name also. In such types of cases, you don't get the characteristic symptoms because patient is not in a condition to give you the characteristics of his disease, how it has started, everything, nothing you can get. Then what you have to do? Here, you should have your own sound senses. That is what Harriman has said. You should have attention in observing. This is more important point which you have to take into consideration. So few things which I have asked, then the doctor who was there, physician who also explained, and the attendants also explained what has happened. Doctor, he has started getting it on face first, then his upper extremity is involved, and after the treatment, his lower extremity is also involved within 4 or 5 days. That was one important indication which was there. It was descending paralysis. Second important thing, when I examined him, one important thing was there. I asked him to raise his upper extremity. He was little bit able to do that. I was in doubtful that if he is able to lift that, then I asked to fold the extremity. And it was not possible. He was not able to fold. So paralysis was more of a flexural muscles than of the extensor muscles. That's what the another thing which you have to catch, grab over there. So I thought better to repertorize. This is my weapon, that if you don't get any characteristic to prescribe remedy, better to repertorize. So what I have done, I have repertorized those 4 features which I have got. I will share the screen. What are the rubrics which were there of this patient? So just look towards, these are the rubrics which I have considered. Extremities paralysis, old people. Extremities paralysis, apoplexy after. Extremities paralysis extending downwards. That was very important in the case. And extremities paralysis muscles, flexor muscles. This was the repertorization. So it's too important to know this through and through. The Baryata Carb was covering everything. Gelsemium was not covering the downward paralysis. Even Natramur was not covering. Ginkam was not covering the flexor muscles paralysis. Even Lachesis was not covering the two things, that is the paralysis extending downwards as well as the flexural muscle. So Baryata was the clear-cut indication for this case. So I have decided better to go with the Baryata Carb. So what to do in such types of pathological cases? What you can do? Better aspect is that always starts with LM. LM in repeated. Baryata, we know that it is slow in action. It bears repetition even in centesimal. But this condition is already a pathological where there was a hemorrhage in the brain. And second important thing was that that patient was in a condition where susceptibility is hampered. You have to react, you have to develop the susceptibility. So he will require a little bit big repetition. So I have decided better to go for the Baryata LM1. But then I have decided that we want to penetrate it more inside at the level of nerves, at the level of brain. So instead of Baryata Carb 1, I have started directly with the Baryata Carb 11 in this case. Because I was expecting the result more at the center. I have given the liquid potency, which was, it was possible for the patient to swallow as well as to put in the RT. I have given the Baryata Carb prepared 500 ml bottle. I asked that give it every 2-3 hours. Continue it. Most important thing that patient who was worsening in last 8 days after admission started responding next day. He started little bit movements in the lower as well as upper extremity. The third day, I visited that hospital daily. I was just watching what is happening. Third day, big movement happened in upper extremity. So it was doing well. So I have continued with the Baryata Carb LM11 and continued it for a month. Patient was discharged after a week from there. And when he returned, he met me in my clinic. It was a wonderful recovery with the Baryata Carb that he was able to walk with a typical paralytic gait, but he was walk without support in my clinic after a month. So Baryata Carb is a very important remedy in old age, where paralysis, apoplectic paralysis, specifically downward direction paralysis, flexural muscle paralysis is, if it is there, think of Baryata Carb. So that's the very important case I wanted to share with you, and that's why I have selected that. Let us go ahead with the Baryata Carb. The few features we have discussed yesterday, we'll go with old cachectic people. Old cachectic people. So old problems, very important remedy. Cachectic means who are able to catch the infection, catch the cold, everything. Very easily they get catch. Scrofulous, affecting the glands, more glandular affection. Tonsils, prostate, even the lymph nodes. This is very typical, especially when the fat or those who suffer from gouty complaint. That is another feature where Baryata Carb is useful along with fluoric acid. Fluoric acid also having old page and gouty complaints. So this remedy, if you are learning, you learn the every sentence from Allen's. Think about it. Old persons having a gout. Think about the two remedies first, Baryata Carb and fluoric acid. It is given over there. So if you make a habit of reading the Mater Medica in such a manner, you'll never forget all those things. Diseases of old men, hypertrophy or induration of the prostate and testes. Very important thing. Hypertrophy is an indication where you can directly get a psychotic tendency of the remedy. Tonsils are hypertrophied. In case of females, the uterus is hypertrophied, bulky uterus. In case of males, it is the testis is hypertrophied. In case of males, it is the prostate which is hypertrophied. It is enlarged prostate, generally old age persons. It is very important remedy without even cancer. Even cancer, it is one of the remedy. Disease of old men, hypertrophy and induration of prostate and testis, mental and physical weakness is concomitant. So it is associated mental and physical weakness. See, the concomitants are very important, which defines the remedy. Patient is having hypertrophy of prostate, you cannot come to the remedy. But old age, That is a very important indication. Second important thing, that patient is having weak memories, forgetfulness. Third important, senile dementia. The physical weakness is also there. Then you can reach towards the Baryata Carb. So you have to understand all those things. When you are dealing with such types of cases, you have to look for what is happening over there. See, the next sentence is very important. That's what the case was there. Apoplectic tendency in old people. What is the apoplexy? Apoplexy is nothing but the congestion to the brain, producing a paralytic conditions. It is on the verge of paralysis or it develops the paralysis. It's apoplexy. And that is congestive apoplexy, which used to have very common with the Baryata Carb. Complaints of old drunkards. Patient who is drunkard for many years suffers from apoplexy. Think of this remedy. Headache of aged people. This is again one more important feature. It is the headache of aged persons who are old enough, who behaves in a childish manner. Yesterday I have told you one case where this fellow was elder one but behaving like childish. And these are very important things which you have to catch. This is the perceiving, observing, attention in observing, where you get a characteristics over there. Then what he says, the persons subject to quinsy. What is quinsy? Quinsy is a tonsillar abscess. So persons who used to get a quinsy take cold easily, very easily catches cold, or with every and even the least cold have an attack of tonsillitis prone to suppression. Slightest patient, the child consumes very small amount of ice cream and next day he suffers. There is just change of weather from heat to cold and person is suffering. They are very catectic. They are very easily catches all those things. And because of which these children are the children who wish to get more affections of the throat, where the quinsy is one of the important indication. Like Hepar sulfuricum, soranum, the quinsy, these are the very important remedy. Hepar is one of the important leading remedy. The soranum, most chilly remedy, most chilly nosode in fact, in your mat remedy. Inability to swallow anything but liquids. This is a symptom which I have explained in yesterday's case. The patient is not able to swallow anything because there was the tonsils were so enlarged, they are kissing each other. There was difficulty in passing the solids from the throat, but child was able to ingest the liquids. It was good. So that is very important. Exactly opposite you get in lachesis. Lachesis, the features are that patient can consume the solids, but there is difficulty in consuming the liquids. That is opposite to you. The same symptom, that is inability to swallow anything but liquids, you get in bacteria as well as in the cilicia. Both remedies are having the similar type of symptoms. They cannot take solids over there. Cilicia, the suppurative tendency is marked. Bacteria, it is associated with the fever, and fever is continuous type of fever where there is associated bradycardia. So you have to understand the core of the remedy. Bacteria, it is a remedy for typhoid fever associated with proportional bradycardia. Pyrogen is the remedy where you get a fever or typhoid fever where there is a proportional tachycardia. It is that they are not proportional, improportional. Sorry, they are not proportional to the temperature. Means what? If the person is having 98 temperature, generally his pulse is 80. If it increases by 1 degree Fahrenheit, 99, pulse goes to 90. If it reaches the 100 degree Fahrenheit, the pulse goes to 100. This is proportional. In case of bacteria, the fever is there, patient's temperature is 104, pulse is 90. Proportional, improportional bradycardia, which happens to be there. Exactly opposite is pyrogen. Pyrogen, the temperature is 100, but pulse rate is 150, 160. That is very typical with the pyrogen. The toxicity we can define, both our remedies are toxic. But one remedy, baptisia, the tongue is very typical brownish coating with elevated papillae over there and patient looks toxic. But in pyrogen also you get the tongue is absolutely clean cut as if varnished. So you can differentiate the remedies. Here, if baptisia is the patient's remedy, then it is associated with such type of fever. Hemorrhoids protrude every time he urinates, like muriatic acid, very important symptom. Whenever patient goes for urination, every time hemorrhoids comes out till they remains inside. It is close to muriatic acid, but muriatic acid is too sensitive. Its sensitivity is very marked with the muriatic acid. The pain is more marked in the muriatic acid. Then respiratory patients. What he says regarding the respiratory. There is chronic cough in psoriatic children, enlarged tonsils and elongated uvula. See, one by one we will see. Chronic cough in psoriatic children. This is the chronic cough. These are children who used to suffer again and again from the bronchitis. But there is more problem lies in throat than in lungs. More commonly, the throat is affected. The tonsils are actual site of action as well as uvula. If you open the complete repertory, open the throat chapter, and you just put elongated uvula, bend to right, only remedy mentioned is the Baryata Carb. And this picture you can get many times in your OPDs. Uvula elongated, bent to right, touching the tonsils, irritating the cough. Baryata Carb. Think about this remedy. We forget. We never think. But this is the evidence which is mentioned over there, and I have utilized in my practice. So this is very important. Enlarged tonsils and elongated uvula, aggravated after slight cold. So little bit change, little bit coldness happens to be there, and person suffers from tonsillitis, person suffers from chronic coryza, person suffers from, or children suffers from chronic cough with elongated uvula and bending towards the right. Illumina is another remedy which is chilly and catches the cold. Swelling and indurations are incipient suppurations of the glands. Glands are hard, indurated, on the verge of suppuration, not yet suppurated. They becomes very, very hard. Baryata Carb, ars iodide, Baryata iodide. These are remedies which you can think about in such types of cases. Induration is very marked over there. So swelling and indurations are incipient suppuration of the gland. Incipient suppuration. It is going, tending towards the suppuration. Incipient. होऊ घातलेलं. Especially the cervical and inguinal glands. Patient comes, children comes, and their mother tells you, doctor, he is having swelling over here. Cervical glands are enlarged. In case of generally old people, you get the inguinal lymphadenopathy more commonly than in children. This is good remedy whenever there is a leukocytosis. Baryata iodide is very specific for it, but Baryata Carb also has that tinge. That's why it is a very important remedy in leukemia also. Offensive foot sweat, like silica. The toes and soles get sore. Offensive foot sweat of the heels. Throat affections after checked foot sweat. Very, very, very important. The patient tries to check the foot swelling, foot perspiration, and that sweating, if it has been suppressed, it enters directly into the throat, producing the quinsy, producing the hypertrophic tonsils. The first remedy you must think about the Baryata Carb. Here there are four remedies which he mentioned to compare the graphitis, but the graphitis it is more soric. Sorinum, more tubercular. Sanicula, again a remedy which is tubercular miasm. Cilicia, psychosyphilitic. This is one more. Both are chilies. The Cilicia is chili and Baryata Carb is chili. But comparatively with the Baryata Carb, you get Cilicia absolutely emaciated. Baryata Carb not that much emaciated. Cilicia, the most chilies, cannot tolerate a cold in any form. Baryata Carb specifically gets affected because of it, and they catches the throat infection in Baryata Carb. Then the last sentence of this chapter, which he explains, great sensitiveness to cold, like calcarea, like calicab, like soranum, like silicea, like sanicula. Many remedies are there. Tendency to catch cold. Tuberculinum is also. But we have to differentiate on the basis of their generality, their mind. Then you can differentiate the remedy. Otherwise, you can't. So this is what the Baryata Carb, which mentioned by Allen. He has mentioned the clinical aspects of Baryata Carb. And my suggestion is to go with boric. You can learn many more. Here he has missed to mention about the atherosclerotic changes which happens to be there in Baryata Carb, which is mentioned by boric very nicely. And that's why it is a very good remedy for hypertension. The pulse which you feel hard very commonly with Baryatas, that is typical. The hypercholesterolemia, that is a very important indication of Baryata Carb. You can think about this remedy. Relations frequently useful before and after soranum, sulfur, and tuberculum. So either you use soranum, sulfur, or tuberculum either before the Baryata Carb or after. Better is always after. Tuberculum you can prescribe in such types of cases to complete cure. These are very important. The complementary remedy is not mentioned by Allen. Complementary is Dalkamara to the Baryata Carb. So you may just write it over there in your book. Complementary is Dalkamara. The action is 40 days. This remedy mentioned by Boric, this is 40 days action is there. After Baryata Carb, soranum will often eradicate the constitutional tendency to quenzy. Hint, make your notes, write it over there. After the Baryata Carb, if you want to stop the tendency to quenzy, soranum is the remedy. These hints one should not forget. This gives you a practical approach. In fact, my suggestion is that you cache those. Write it, make a separate notebook, write those keynotes. These are most important in your practice. Similar to alumina, one-sided paralysis, slowly developing paralysis, constipation, old people's remedy, calcarea iodata, glandular affections where thyroid is at fault, even the prostate is at fault. Dalkamara is comparatively subacute, and that's why Dalkamara and Baryata iodide they complement each other. Dalkamara is the remedy where you get the aggravation during damn cold weather, wet weather, a hydrogenoid constitution remedy, where rheumatism is alternating with the skin affection or rheumatism is alternating with the lung complaints, asthma. And this is a very important remedy. So we must know the Dalkamara. My suggestion to all of you, read the Dalkamara from Vitulka's Essence of Remedies. No one have mentioned the mental state of the Dalkamara. Vitulkas has very nicely elaborated in his Essence of Remedies how is the Dalkamara personality, and you'll never forget. You get then more Dalkamaras in your OPD. Madhu has asked, Soranum single dose or 3 doses. 3 or single, it doesn't matter. It is one and same, depending upon patient susceptibility. You can give 1 or 2 or 3. It is ultimately 1. So it doesn't matter. Every 15 minutes, if you repeated 3, it is 1 and same. Fluoric acid, again having action very specifically over there in gouty complaints in old people. Fluoric acid is most syphilitic remedy in your Metramedica. Iodine, glandular affections, close to the Baryata Carb, silica. Many places it is very close to the silica. So this is a wonderful remedy to be learned and apply in practice. Incompatible after calcarea in scrofulous affections. If you would have given calcarea, don't give Baryata thereafter. If you would have given Baryata Carb, you can give calcarea. Keep it in your mind. After Baryata Carb, you can go with calcarea. But after calcarea, you can't go with the Baryata. This you should keep it in your mind. If you, after the calcarea, if you are thinking about the Baryata Carb, then in between you must use any other remedy. Then turn towards the Baryata Carb. This is a practical aspect of using the remedy. General modalities which he has mentioned, aggravation when thinking of his disease, like oxalic acid. This is very important. Whenever he thinks about his complaints, gets aggravated. Baryata Carb as well as the oxalic acid. Thinking of the complaints aggravates. Lying on painful side aggravates the complaint. Aggravation after meals, washing the affected parts. When you wash the affected parts, there is aggravation. Basically, when you wash it with cold, then always it gets aggravated. So see, this is wonderful remedy explained by Allen in this book, and he tried to explain the most practical aspect about the remedy. Specific organ have not fully developed. Please explain, sir. Baryata Carb is the remedy for dwarfism. I had a case who had hypoplastic uterus, but ovaries are there. I think I shared this case with you. And she was typical of a Baryata. Looks were Baryata. She was dwarfish, short stature. She was they went to the gynecologist, then they have gone to the sterility specialist, and they said that her uterus is not fully developed. You have to give the hormones, then we have to wait at least 2-3 years, and lakhs of monies will be required. He was the person who was a Unani practitioner. His wife was there. It was very early in my practice, 1995, 97. 1997, because the hospital was there. So I have, they came to me. I took her case. I started with Baryata Carb, and I started Baryata Carb in repeated doses, 30, depending upon her susceptibility and all those things, characteristics of Baryata. After Baryata Carb 30, she started growing in a normal manner. She was developing. Her growth was good. But we have not done the sonography thereafter, because basic problem was finance with them. So the sonography, 2 reports were there, and both of them shows the hypoplastic uterus. They were done 4 months back. So they said, when I asked, we can go for the sonography, he said, doctor, we can wait for another 2 months, then we will do it. Financial condition is not good. I said, it's okay. I have continued him with her on the Baryata Carb. And to my surprise, she got good menses after starting the Baryata Carb. Actually, she used to get the only a metrorrhagia, just some spots. But she got good menses there after. It was very interesting. So I have continued with medicines, and to my surprise, in the 3rd month, she conceived. They were too happy. She was a case of epilepsy in childhood, treated with many anti-epileptic drugs in childhood. That was a big history in that case. So it was a suppression which has happened because of those anti-epileptic, which were nearly about 5 to 7 years consumed by the patient. That might be one of the reasons. And then we confirmed the pregnancy, and her pregnancy was good. Uterus was developed. And then thereafter, her husband asked, they were from Calcutta. So her husband asked their relatives to come over there. Unfortunately, after 5th month, she got an attack of epilepsy, which was there in childhood. So question was, what to do? I said, let it appear. We'll not do anything. We'll continue with the same medicine. We'll continue with the same medicine. And to my surprise, when I raised the potency of Baryata Carb, few doses, there was no further recurrence of convulsion, and she was delivered in our hospital. Normal delivery, just forceps were applied at the end because she was short stature. So this is a wonderful remedy. Organ development has happened because it was suppressed at the time. Most typical thing was the convulsions, epilepsy suppressed, and that has created the problem. There is one patient with me at present having absence of ovaries. very hypoplastic uterus. I have told them the prognosis is bad, syphilitic. She's 15 years old, never developed any secondary sexual characteristic. It is right from birth she is having this. So you have to consider whether it is congenital or whether it has developed later. If you get the history, it develops later, then you can treat. Go for it. It's not only Baryata, you have to think about miasm. It is mostly the psychotic or syphilitic miasm plays very vital role in. Sora is not at all there in such types of cases. So your remedy should be very confirmed regarding the miasm. So that's all regarding the organ which are not fully developed. You can utilize the remedy. Any other query, question? So we'll conclude today's session. We'll meet again tomorrow with the next remedy in the syllabus, third year syllabus, and we'll continue with it. So that's all for today. Thank you. Thanks a lot and good night.
Thank you, sir. Good night.